right. Good morning, everyone. I'm Harvinder Sandhu, MLA for Vernon Monashi. Before I begin my remarks, I would like to acknowledge that today we are gathered on the traditional Silks territory of the Okanagan Indian Nations, and I thank them for the stewardship of their land. We're joined here today by very special guests. Sheila Malcolmson, BC's Minister of Mental Health and Addictions, and Doug Cochran, I see Chair of our Interior Health Board, and Susan Brown, President and CEO of Interior Health, Loyal Woolridge, Chair of Regional District Hospital, and Hospital District Chair, also as a City of Kelowna Councillor, Patrick Spinks, Board President of Bridge Youth and Family Services Society, John Yershenko, I'm trying to see where everybody's standing there here, the Director of Bridge Services, Julie, Program Manager, and all the distinguished guests, if I missed any names, and of course our Mayor of Kelowna, Mayor Colin Basra. So I would like to welcome everybody, including media. Before we jump into exactly why we're gathered here today, I would like to invite West Bank First Nations Elder and Knowledge Keeper Grouse Barnes to start us off with a traditional welcome to do the good start. So, Elder, thank you.
Good morning. How is everybody this morning? Spring is here. Who's glad spring is here? Ta-da! While lim kulin jutin kan wist, tali khastis buhus kan alata sil ko quast. Akad schools to maha is it chit. Tali khast kil is naksil atiap chin. Tali khastis buhus wikman yayati khatusi he taltulki silkwa is buhus ul tali khasta kha schools the khast. Mat open kistel koinig chitwa la kailga ul khast wilga. Why up and why tichukulomitum hula, why skitski schreibt will. Tali khast equal still chal, equal temich, equal siul. Ja, stim, it's ha stim, nichwa ha. Why limlim can Allah to seal quest. Thank you, Creator, for allowing me to say a few words and a little prayer. You know, the things that are going on here in this house here is so important to Kelowna. You know, it's so people that are in need, people that are hurting will have a place to go and to better themselves. You know, all these things that we do in a good way. And I see all the leaders here that are responsible for this. They have big hearts. And it's really good to be a part of instead of part against. This time of year, you know, the land is changing. Spring is here. And I'm so glad that spring is here. The sun is getting warmer. Pretty soon you can go swimming, whatever it is you do. So I'm very glad to be here this morning to be a part of. So let's enjoy each other's company and let's get on with what we're going to do. Thank you very much. Limlim. I was going to say, what's the name for Ogopogo? Mayor, you're under the gun.
I always butcher it. Even under your guidance, I still have not learned.
Okay, here we go. It's Nachachaitk. Nachachaitk. First part of the word is chacha, which is sacred. Second part of the word is itk, which is water. So it's sacred being of the water. Ogopogo came to be in 1924 through the Kelowna Board of Trade. My interpretation of Ogopogo is, come, spend your money. Guys, have a good day.
Thank you so much, Elder Grouse. for starting us off in such a good place and in a very humorous way, and beautiful, kind words, beautifully said. Appreciate it. I'm thrilled to be here today for this very important announcement about treatment and recovery services that are so vital to our community, and not only community of Kelowna, also surrounding communities like ours in Vernon and area. So before I share much, I will say our first speaker, Minister Malcolmson, she will tell us more about that. So I'll invite Minister Malcolmson on the stage. Thank you.
Thank you, Harwinder. It's such a joy for me to have Harwinder's leadership in our government caucus, being a nurse herself and being in serving from an Okanagan perspective. We benefit from her leadership. I'm very grateful to be on the territory of the Okanagan Nation. And thank you, Elder Grouse, for the opening. It's good to have West Bank Energy here, real leadership from West Bank First Nation, and very glad that you're here. And to have our health authority friends and our NGO friends from the bridge here together to recognize the work that's happened and the impact on communities, especially over the last 2 years between the pandemic, toxic drug poisoning crisis, 2 public health emergencies at the same time, forest fires, floods, an unprecedented immunization campaign that the health authorities in all parts of the province have implemented, and as well the ask from our provincial government that the health authorities work with us and implement the system of care that we've been working very hard these last 4 years to build, one that didn't exist before. I recognize we've never asked so much of our health authorities and of healthcare workers and frontline workers and people in the nonprofit sector. It's been a difficult work. We are immensely grateful for your service, and we recognize that the province is asking a lot of you and continues to ask a lot of you. In particular, I honor the tragic and unprecedented loss of life to the toxic drug crisis, a crisis worsened in every way by the COVID pandemic. I feel the terrible grief of frontline workers, families and friends of those who have been lost to the increasingly contaminated drug supply, and and how hard they worked to try to save lives, and that we haven't been able to. It's an unspeakable loss and informs our work every day. For too long, treatment and recovery systems in British Columbia were not available to people in the way that they needed them and in the place and time that they needed them. This is especially true for people with complex mental health and substance use challenges. These are the people who needed the highest level of support, but sadly have often fallen through the cracks in our system. Our aim, our ambition, and our commitment as a government is that when people need and are ready to take that step toward recovery, that they are met with care, and that the systems are ready to receive them. And that's why we're here today. We're here to celebrate the addition of 22 detox and transition and stabilization beds right here in Kelowna, some of them in this building right next door to us. I'm very grateful to partner with Bridge Youth and Family Services Society in Kelowna, who will be operating these beds in this brand new facility. 13 beds will be for withdrawal management, also known as detox. 9 of the beds are for stabilization and transition. This is in addition to the 10 youth substance beds that the Bridge is opening in conjunction with the health authority, opened a year ago, just in March last year, again aimed at filling a real gap in the system around youth substance use treatment. All these new beds are a crucial part of our comprehensive response to the toxic drug crisis and a vital building block in the system of mental health and addictions care that we are building across British Columbia. It's part of our government's $132 million investment over 3 years that we announced in last year's budget. This is a historic $500 million spending on mental health and addictions care. And that $132 million is singularly targeted towards addictions treatment, and particularly filling the gaps in the system where people often fall through the cracks. Also, with this year's budget 2022, with that investment of $164 million, over the next 3 years, our government is expanding complex care housing beyond just the first projects that we announced in January. Complex care housing is a groundbreaking approach to address the needs of people who have overlapping mental health, substance use, and often anger management issues may be related to acquired brain injury. These are people often left to homelessness. The people who access complex care housing will get supports where they need them, including services from nurses, peer workers, and other health professionals. Kelowna Mayor Colin Bazarin has been a very constructive and vocal advocate, along co-chairing the Urban Mayors Caucus with Victoria Mayor Lisa Helps, and I really thank Mayor Bazarin and his team for being very active participants in the framework for complex care housing that we built together in partnership with people on the front line. And today, I'm announcing that this year's budget includes complex care housing right here in Kelowna, as well as in Kamloops. It's in addition to the first 4 complex care housing units that we announced in January, 2 in Vancouver, 1 in Abbotsford, and 1 in Surrey. And I'll have more details on what will happen in Kelowna as that planning progresses. Providing more supports in community is a central commitment and an action item of our government over the last few years. The past year, we opened 29 new publicly funded substance use treatment beds in the Okanagan. We expanded funding for community-based counseling programs for low-cost or zero-cost counseling, including 10 community agencies in the Interior Health region, including Kelowna, Kamloops, Penticton, and Vernon. Since 2018, we've opened 7 urgent primary care centres in the interior. This includes urgent primary care centres in Kelowna, West Kelowna, Castlegar, Cranbrook, Kamloops, Penticton, and Vernon. We've added 5 new integrated substance use treatment teams throughout the southern interior at West Kelowna, Penticton, Kamloops, Cranbrook, and Enderby Salmon Arm. Integrated substance use treatment teams operate a little bit like how you might imagine home care. For people that aren't willing or not able to walk into a treatment facility, these health authority reps, professionals, go out and meet people where they're at, overcoming maybe the fact that they are shift workers or have transportation or childcare complications that have interfered in the past with them getting access to treatment. And just yesterday, with my colleague, MLA Harvinder Singh, I was in Vernon to announce the addition of 4 new services and the expansion of 4 other services, as well as funding 19 full-time workers for substance use and mental health supports in Vernon alone. We're fighting the toxic drug crisis from every angle, including leading the country on prescribed safe supply and decriminalization. We're making investments to combat the drug poisoning crisis and build the system of care that simply didn't exist 5 years ago. And we know there is much more to do, but we will not stop working until everyone in British Columbia gets access to the services that they need and deserve. But thank you to all of the partners who have made this day possible. Thanks for your attention, and I look forward to seeing these beds open and welcome people into care here. Thank you.
Thank you so much, Minister. This announcement also means so much to me, as I previously mentioned, that it's not only going to benefit people of Kelowna, it'll also help people in surrounding communities. And it means that when young people and adults ready to get the help that they need, they can access services, no questions asked. And these services will help many members of our communities on their path to recovery. I would especially like to thank Minister Malcolmson for her continued dedication in ensuring that people in the Okanagan have the supports that they need. And coming from healthcare background, I've seen, and yesterday's visit did reassure me that how much work that is being done on ground. We have much more to do. And I really appreciate the approach that we're taking and the work that NGOs are doing, like Bridge and everybody, Interior Health. It's going to take us closer to fill those gaps, to strengthen the system that we are planning to put in place, not only put in place, to strengthen it, to fill the gaps for more streamlined resources. So now I would like to invite Susan Brown, our President and CEO of Interior Health, to share some words how she likes to see these services being added. So thank you so much.
Good morning, everybody, and thank you, MLA Sandhu and Elder Grouse, for getting us off in such a great way. And I'm so glad he did the Ogopogo test with Mayor Bezran, because I know I would have failed. And thank you, Minister Malcolmson, for being here today. It's so nice to do these announcements in person and have an opportunity to celebrate. And before I begin, I'd just like to recognise that I live and work in the unceded territory of the Sault's Nation. As Minister Malcolmson mentioned, through the ministry's $132 million investment, we're able to expand services throughout interior health. These withdrawal management and stabilization beds are an excellent example of what you can do with innovation and great partnerships. The beds are a new service to the region and will be available to people living not only throughout the Okanagan corridor, but throughout the whole of interior health. This means anyone from Salmon Arm, Vernon, Penticton, Trail and beyond are encouraged to access these beds for support. I would really like to thank the Bridge Society once again for stepping up and delivering these services on behalf of Interior Health. We will be here to support you and your staff and as they deliver these important services, and we look forward to seeing the first clients come through the doors this summer. It's my understanding the Bridge is going to put up their first posting today for jobs, and I really wish you all the best of luck with recruitment and encourage anyone interested in joining this amazing team to apply on the jobs. I've met their manager, Julie, and she's got a vast background in mental health and substance use, so I know she'll lead an outstanding team. And the Bridge is not a new partner to Interior Health. They've been a valuable partner over the last 10 years and providing supported recovery housing to outreach overdose prevention and adult and youth withdrawal management service. The Bridge is valued in our region, and we're excited to see these services expand. And just last year, we awarded a contract to the Bridge to operate 10 substance use treatment beds for youth, providing a live-in environment for young people experiencing addiction. Like the adult beds announced today, these youth beds are for anyone throughout the region. So to everybody listening today, please spread this message far and wide. Interior Health now offers substance treatment use beds for youth and adults in Kelowna and beyond. Every door is the right door to access these services. That means you can call IH's 310 MHSU, which is 6478 phone line, or visit any primary care provider to get access. You could also just simply walk into an urgent primary care centre and get a referral, or you can call the Bridge itself. This is us listening to your feedback. Don't put barriers in front of getting access to these services. The referral process is intended to be barrier-free, and the information is available on IH's website and on the Bridge's website. And together we're committed to making these resources available to those who need them. So today is just such a wonderful way to celebrate these investments and really recognize the hard work of everyone that's got us here today. Obviously our partnership with the Bridge, the tremendous amount of work on their behalf, and I think over the last few years, and speaking to the executive director this morning, that partnership is becoming well-oiled, and as we work to engage in contracts and executing on services, it's working really well. I'd also really like to acknowledge some of the IH leadership, Danielle Cameron, Deb Preston, Shalyn Lutwin, Debbie Morris, and Dr. Paul Carey. They are instrumental in partnering with the Bridge and moving these services forward. And so many other our leaders are here today, and it's a great opportunity to celebrate. So thank you, Minister Malcolmson, for your support and for all your ministry staff in such a great partnership. Thank you.
Thank you so much, Susan, for the work you do and for sharing your words. As I said, it's very exciting news. Now I would like to invite our next speaker, Mr. John Hirshenko, to share some of his words. He's not. Oh. Okay, so my apologies. Patrick Spence. Then, according to my list, I thought I had John. So, Patrick, if you want to share some words, my apologies.
Thank you. The Bridge Youth and Family Services is honored to do this work on behalf of the province of British Columbia and alongside the individuals who need and have been waiting for this critical service. This investment in the Okanagan is going to more than double our capacity to provide withdrawal management services. And what that means in practical terms is that wait times are going to be reduced and people can get the care they need when they need it. The investment, the addition of the transition and stabilization services means that the Bridge can now provide wraparound support. We're now in a position we can provide a continuity of care to which we've always aspired to for individuals, regardless of where they are on their recovery journey. As with all the services that we provide at the Bridge, this work will reflect our commitment to providing individual care. It's person-centered, trauma-informed, dignified, and quality care that is our hallmark. Lives will be transformed as a result of today's announcement, and our community as a whole will prosper. On behalf of the staff and the board at the Bridge, I want to convey our thanks to our provincial and local governments partners for making today a reality. And on behalf of the people in our community that are struggling with addictions and dependence on alcohol and other substances, a heartfelt thanks for making funding these projects a priority.
Thank you so much, Patrick, for sharing your words. And as I said, working in healthcare, I've realized that it's not one size fits all. And I also want to applaud Mayor Colin Basran's advocacy over the time, which I've seen and witnessed. And finally, it's reassuring to see everything coming to fruition. As I said, this doesn't stop here. The work continues, and everyday efforts from ministry and from all the people working at the ground, we can see that it's going to make it happen. And every services or every step we add to these existing services will save more lives. Every single life matters, and it matters dearly because they are somebody's loved one, daughter, son, a father, or you name it. So it really matters, and every day's work helps us, and teamwork is what will help us to achieve the goal that we have in mind. And so this brings the end of this morning's event. Again, I would like to thank all the guests and media for attending, and if I missed any names, my apologies, but we're glad to have you here today. And it's a beautiful day. I would like to invite Chris now so he can moderate question and answer period. Chris, thank you.
The media partners, want to give me a little signal if you have questions, or do you want me to just run through the crew? You're good? You're good? Good? Yes? Good? Okay, and hey, are you a yes? I'm okay. Okay, well, Connor, you're front center. Why don't you go ahead? So Connor with Kelowna 10.
Okay.
Thanks for that. I guess just give a little bit of transparency into like why now to add these add this funding for both the interior, because as we've seen, all these mental health calls related to crime the last little bit. So I guess why was it now such a critical moment to add this for both not only Kelowna but for them as well?
So because the province has been so behind, there wasn't a system of care in the way that we have a primary care system. We just didn't have that continuum of care. So the first work that my predecessor, Judy Darcy, did was to create, based on all the input from people on the ground, what is the plan that we need to construct a system of care, an intact system of care for mental health and substance use. And some supports have been added over the past few years. Last year in the budget, the 2021 budget, I secured through my ministry $500 million of new investment in mental health and substance use to be implemented mostly through the health authorities. In some cases through education, in some cases through Ministry of Children and Family Development, but the main partner are the health authorities. So they then started last summer to implement that work. But honestly, we haven't been able to get out into the regions to do these in-person announcements. And so what we're seeing today is the beginning of the work that really started arguably 9 months ago. To design the contracting, to issue the requests for proposals, to do the bids about who would be the service providers. But our provincial government is funding safe supply, medication-assisted treatment, new in-person, in-bed treatment facilities, detox, across the whole continuum, all the different forms of care that people need to tackle mental health and substance use challenges. So this has been a long time coming, and this work specifically with Interior Health and then the organizations that they contract has been happening over the last year.
Yeah, just is it still alarming to see those numbers, as scary as they are, within just the province of all those toxicity deaths that we're still seeing?
It's terrible to have some hope that we were going to be able to turn the toxic drug crisis around in 2019 because lives lost finally started to fall in the 2019 year for the first time since the public health emergency was declared. That gave us a lot of hope that working with Frontline, with Health Authority, with NGO partners, the interventions that we brought in as a provincial government did start to save lives, and that continued for the first 2 months of 2020. As soon as the pandemic hit, people got more isolated, more people used drugs alone, more people were under mental health pressure, and most tragically, the toxicity of the illicit drug supply just went through the roof. The coroners measured that in the month before the pandemic, toxicity of what had killed people that fell to toxic drug poisoning was between 4 and 8%. In December, it was between 24 and 28%. So notwithstanding that almost every week, with a variety of health authorities and partners across the province, we've been adding more substance use and treatment facilities almost every week. That has been outpaced by the tragically increased toxicity of drugs. So that's why it's especially important for us to be working with prescribers, practitioners, to prescribe safe supply, which we've been doing for 2 years, but also to have that detox treatment and post-treatment recovery available to care for people when they're ready to take that step. It's a huge task that we're asking the health authorities to take on, and we're very grateful for the partnership at this really challenging time.
So Sydney from Castanet.
We're just
Thank you.
wondering here, you mentioned 22 detox beds and stabilization. Can you just walk us through kind of what that would look like? I know it probably varies from patient to patient. How long would a typical stay be? And kind of when someone does come in first off, what is the treatment like?
Yeah.
Right?
Yeah, thanks. Well, I'll take a big picture description as it relates to the continuum of care that we're trying to build, and then I'll invite Susan or Patrick to stand in as well and fill in the gaps. But what we've been hearing from people who use drugs, any substance, people who have been through treatment, and also the practitioners on the front line, is for one, we want people to be able to get into detox and treatment when they're ready. And here's a really great example. For people that can't see, the hospital's right across the road from this facility, and the emergency room is right there. I was very encouraged to hear, as happens in other health authorities as well, that there can be that direct link from discharge planning directly into detox. There's also other NGOs that the health authorities contract where somebody coming into a supervised consumption site develops that relationship with the operator and in some cases can walk across the hall into detox. More often what we hear are people that are ready to go into detox and there isn't a space. And that is a gap that we're trying to fill. And so, for example, us adding new detox beds here is a really important step. And we know we need more capacity in every part of the province. The other thing we've heard is that after detox, a wait between detox and treatment can also result in a relapse. And as I heard this morning on the tour of the bridge, because their treatment facilities do a cohort system where you have to wait, everybody comes into the program on day one and goes all the way through it. It may be that there's quite a gap, and even if there's room in the program, they may have to wait for the next cohort to finish. Other treatment facilities have a continuous intake, and so they don't have that same kind of gap. As well, we hear in other parts of the province, publicly funded beds may have a very long wait time, and the privately funded may be very short. So again, this is an example of not yet having that continuum of care. And then we also hear that after treatment, sometimes people, particularly if they have unstable housing, need to have a period of lock-in time. And so that's where the suites that we saw here this morning are so interesting. People can kind of lock in what they've learned after treatment, get that stabilization that then allows them to move into their next system. And different organizations will have different time models. Some of them move people through quite quickly. When our MLA Sandhu and I visited yesterday the Turning Point, they have people that have been in residence for a year, maybe a year and a half. They take on mentorship of the next wave of people that are coming through the program. So this is where it's especially important and part of our commitment as a government that we offer a variety of forms of treatment, different styles that different NGOs offer, but that we also have a really strong transparency so that families and people suffering from substance use challenges really know what they're getting. They have a very clear picture of what's offered, what the care model will be, and they can choose the kind of system that will work for them. With that, I'm going to turn to the bridge to answer the question about specifically what will happen here.
And so I think our adjacency to the hospital is a key part of this new program. When people present there with problematic substance abuse and need medically supervised withdrawal management, they can come across the street and be supported here. The typical stay here will be about 5 to 7 days. It really depends individually on the acuteness and how much medical supervision they need. From there tends to, in the past, there haven't been any stabilization or transition beds in place. So this will, now we're funding those beds, or those beds are being funded. They will help people transition into those treatment programs that Minister Malcolmson just referred to. Those are 6 weeks in duration, but because we alternate cohorts between male and female cohorts, there can be that gap. Those stabilization beds are going to be key to helping people stay healthy while they're awaiting treatment. Those programs run for 6 weeks, and then again we have supportive housing and those transition beds where they might stay for 3 months up to 6 months, very much dependent on the individual. And there are other more supportive housing where we do outreach long-term to help people make sure that they're plugged into the right supports and getting the care and support that they need. But that's the typical progression through the programs.
Yeah, just while we're on the subject of substance, in terms of the safe supply drug programs, I know there's talk about expansion in BC. What's your perspective on that and the need potentially for it making its way to Kelowna?
So we've just toured also this morning another new interior health clinic where individuals who are at risk of overdose and are struggling with substance use can be prescribed safe supply. It's part of our healthcare system, but certainly was identified when we started first prescribing safe supply 2 years ago. British Columbia being the first place in Canada to do this. We got feedback both from people who use drugs and from clinicians that people wanted more options, more access points, and also more medications to choose from. So last summer, Dr. Henry and I announced in July an expansion of British Columbia's safe supply, prescribed safe supply program, which is now being rolled out by the health authorities. So again, that was my reference to how much it is we're asking health authorities and frontline workers to do right now. It's a lot. It's a novel program, not mirrored anywhere else in the country, and so we are learning as we go. Also keeping in mind patient safety and then the need for prescribers to really learn after the fact some of the things that they didn't learn in medical school, again, because this is a public health orientation to prescribing. But we're seeing it almost every visit and every conversation that I have with all 5 health authorities and First Nations Health Authority. We're learning more about prescribing, what we can do to support doctors, the work that we can do with the colleges and with Doctors of BC, Nurse Practitioners Association. Keeping in mind nurse practitioners are also prescribers. And maybe I'll also talk about medication-assisted treatment because it's also, or maybe I'm going to scoop something. Never mind. We're going to talk about that tomorrow. But I'll say that, I can? Okay. So another thing that British Columbia is doing, which again we're asking nurses to do that nobody else, you know that nurses can't prescribe aspirin for the most part. In British Columbia, they're able to prescribe medication-assisted treatment. Suboxone would be one example. And so also in our announcement yesterday, MLA Sandhu and I, along with the health authority, there is an expansion in Vernon now of the kinds of medications for medication-assisted treatment. And visiting just downtown here, the Interior Health primary care, but also substance use clinic, to be able to see the prescribers interacting with people, and that they are offered both safe supply and medication-assisted treatment is, again, a first, in the country that nurses are able to do this work. And this is my scoop, is that Interior Health has more nurse prescribers than anywhere else in the province. And since BC is the only place doing this, in fact, more than anywhere in the country. And I'm very grateful to the nurses at a really challenging time who have stepped up for a new form of training, have taken the time for preceptorship to be able to have these conversations, and for them to be able to initiate prescriptions for people who are living with substance use challenges is another step forward, particularly rural and remote areas where it's going to be easier for us to recruit and have those communities retain nurses. It's a huge expansion, and one that we're really just on the edge of seeing some huge benefits. So thank you again to nurses, because they're stepping up in a multitude of ways, and this is truly life-saving work.
Jake, I'll check on you in a second, but Taya, do you want to take us away?
Yeah, just piggybacking on
Okanagan
the
Global.
slide here. I know you mentioned it's a slow rolling, everyone's learning as you go. Do you have a time frame as to when Interior Health may see more programs or more extensive or what we already have?
Yeah. As new substances are added and approved by Health Canada, as more clinics and more clinicians are trained and come in, and also as the health authorities across British Columbia continue the process of adding it into their primary care programs and their offer, we're going to see changes, every month. We're expecting some news for Interior Health around additional offers of prescribed safe supply, even just within the next couple of months. And so we're just going to continue to let people know as the services are available. Some of the approvals do depend on Health Canada. It's not entirely inside British Columbia's aim or are within our ability to control all of the timing. But just want everybody to know, from every ministry in the BC government, we feel the urgency of the toxic drug overdose crisis. Everybody that I meet on the front lines, NGOs, peer workers, and certainly the health authorities, they all want to have more tools to be able to tackle this, and we're rolling it out as fast as we can. But right now, people are able, in Kelowna, in Victoria, in Vancouver, in many communities across British Columbia, they can be prescribed safe supply. And so as Susan Brown said, 310 MHSU is the number that you can call in order to get connected to a primary care provider that can start you on that path and assess whether it's the right step for you.
Now bouncing back to the beds here, you might have mentioned this already, but some of the beds are going up to 22 going in this location, or are they all going in this location? If not, where are they going?
So this is an Interior Health decision to contract the Bridge Society to do this work. And some of the beds will be built and opened in this building, and then some will also be available in the existing facilities. And do you want to add more to the mechanics of that? Okay, let's go Patrick back.
So our existing program right now has 8 beds and 6 stabilization apartments. We are adding on an additional 8 beds here, expanding our other facility to another 4 beds. So it'll be a total of 22 beds for the withdrawal management and a total of 10 of the supportive housing. But again, they are split between 2 different properties. This will have 4 apartments and 8 beds. The balance will be at our other location.
Gentlemen? Back around? Back around? Anybody else?
Excellent.
All right, that concludes. Thank you so much, everybody. Thank you, Minister.
Yeah,
We're going to
thank
take
you.
a group photo.